Blood cancer treatment depends on the type of blood cancer, the stage of the cancer, and the patient's overall health. Treatment options for blood cancer include chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell transplant, and supportive care. 1. Chemotherapy. Chemotherapy is a common treatment for blood cancer. It involves the use of drugs that kill cancer cells or stop them from dividing. Chemotherapy can be given orally, by injection, or intravenously. The drugs can be administered in a single dose or in a series of treatments over several weeks or months. Side effects of chemotherapy can include nausea, vomiting, hair loss, fatigue, and an increased risk of infection. 2. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells or prevent them from dividing. It can be delivered externally or internally. External radiation therapy involves directing a beam of radiation at the affected area from outside the body. Internal radiation therapy involves placing a radioactive source inside the body near the affected area. Side effects of radiation therapy can include skin irritation, fatigue, and an increased risk of infection. 3. Targeted therapy. Targeted therapy is a type of treatment that targets specific molecules or pathways involved in cancer growth. Targeted therapy drugs can be given orally or intravenously. Side effects of targeted therapy can include nausea, diarrhea, skin rash, and an increased risk of infection. 4. Immunotherapy. Immunotherapy is a type of treatment that uses the body's immune system to fight cancer. It can be given orally, intravenously, or by injection. Immunotherapy drugs can stimulate the immune system to attack cancer cells or block signals that cancer cells use to evade the immune system. Side effects of immunotherapy can include fatigue, flu-like symptoms, and an increased risk of infection. 5. Stem cell transplant. Stem cell transplant, also known as bone marrow transplant, is a procedure that replaces damaged or diseased bone marrow with healthy stem cells. The stem cells can be obtained from the patient's own body, autologous transplant, or from a donor, allogeneic transplant. Side effects of stem cell transplant can include nausea, vomiting, fatigue, and an increased risk of infection. 6. Supportive care. Supportive care is an essential part of blood cancer treatment. It involves managing the symptoms and side effects of the cancer and its treatment. Supportive care can include pain management, nutrition support, and psychological support. In conclusion, blood cancer treatment can be complex and may involve a combination of different treatment options. The goal of treatment is to eliminate the cancer or slow its progression while minimizing side effects and improving the patient's quality of life. It is essential to work closely with a healthcare team to determine the best treatment plan for each individual case.